Question 1. A behavior analyst is providing services to a client and discovers that the client's parent is also a neighbor and close friend. What is the most appropriate ethical action for the behavior analyst to take? A. Continue providing services as long as the parent agrees. B. Disclose the multiple relationship to the client's funder. C. Immediately terminate services and refer the client to another provider. D. Address the multiple relationship and determine if it can be managed or if referral is necessary. Answer. D. Address the multiple relationship and determine if it can be managed or if referral is necessary. This question is about navigating multiple relationships, which is a key ethical consideration. The keyword most appropriate ethical action guides you to the best practice when you have a relationship with a client or their family outside of your professional one. Behavior analysts need to be careful about having both a professional relationship and a personal relationship, like being neighbors and friends with the same person because it can affect their objectivity or harm the client. The ethical code doesn't always require immediate termination. Often, the first step is to recognize the potential issue, discuss it, evaluate if it can be managed safely without harm, and only refer if it cannot. For example, if you live next door to a client's family, you'd first discuss how this relationship might impact services and decide together if you can maintain professional boundaries or if it's better for the client to work with someone else. The takeaway is, don't ignore multiple relationships, assess the risk, and address it properly, which might mean managing it or referring. Question 2. A behavior analyst is asked by a parent to recommend a specific therapist for their child's physical therapy needs. The behavior analyst has no direct experience with physical therapists in the area. What should the behavior analyst ethically do? A. Recommend a physical therapist they heard good things about from another parent. B. Tell the parent they cannot recommend anyone as it is outside their scope of competence. C. Provide a list of several licensed physical therapists the parent can research themselves. D. Recommend a physical therapist who is a close friend. Answer. C. Provide a list of several licensed physical therapists the parent can research themselves. This question tests your understanding of professional boundaries and competence. The key phrase is no direct experience with physical therapists in the area, indicating you are being asked for a recommendation outside your area of expertise. Ethically, behavior analysts should not provide advice or make recommendations about services they are not qualified to evaluate. Recommending a single person based on hearsay or friendship is also inappropriate. The best approach is to help the parent find resources so they can make an informed decision themselves. Providing a list of licensed professionals in the area allows the parent to research credentials, experience, and availability. This respects your boundaries while empowering the parent. Remember, it's ethical to help people find resources, but not to recommend specific providers you can't properly vouch for. Question 3. A behavior analyst is developing a behavior change plan for a child with challenging behavior. What is the most crucial factor the behavior analyst must prioritize when selecting intervention strategies? A. The ease of implementation for the caregivers. B. The strategies that are the least restrictive alternative. C. The strategies that will produce the fastest behavior change. D. The strategies that are most popular in the field. Answer. B. The strategies that are the least restrictive alternative. This question is about the ethical principle of choosing interventions. The crucial phrase most crucial factor points to the highest priority among the options provided. While ease of implementation, speed, and popularity might be considered, the ethical code mandates prioritizing the least restrictive alternative first. This means choosing interventions that are effective but interfere least with the client's freedom and daily life. For example, using reinforcement to teach a replacement behavior is generally less restrictive than using punishment to suppress an unwanted behavior. It's about balancing effectiveness with the client's dignity and rights. Always start by considering the gentlest, most positive, and least intrusive methods that are likely to work. Question 4. A behavior analyst receives a subpoena requesting confidential client records. What should the behavior analyst do first? A. Immediately send the records as requested by the subpoena. B. Ignore the subpoena as client confidentiality is paramount. C. Notify the client or their legal guardian and seek their consent or guidance. D. Consult with a colleague about whether to send the records. Answer. C. Notify the client or their legal guardian and seek their consent or guidance. This question addresses handling confidential information when faced with a legal demand like a subpoena. The keyword first tells you this is about the initial required step. While confidentiality is critical, subpoenas are legal orders. However, you usually cannot just hand over records. Ethically and often legally, your first action is to inform the client or their guardian about the subpoena. They may choose to consent to the release, or their legal counsel might advise you on how to respond, possibly by filing a motion to quash the subpoena. This respects the client's right to control their information, even when faced with a legal demand. Simply ignoring it or sending records without consent are incorrect actions. Always inform your client about requests for their confidential data first. Question 5. A behavior analyst is asked to provide services to a client whose family is unable to pay the full fee. What is an ethical consideration the behavior analyst must keep in mind? A. Services should only be provided if the family can pay the full standard fee. B. The quality of services can be adjusted based on the client's ability to pay. C. Behavior analysts should avoid providing services to clients with financial limitations. D. Behavior analysts should consider pro bono services or sliding scale fees if feasible and agreed upon, but maintain service quality. Answer. D. Behavior analysts should consider pro bono services or sliding scale fees if feasible and agreed upon, but maintain service quality. This question explores the ethical considerations when dealing with clients facing financial hardship. The core concept is balancing the need for services with the client's ability to pay while upholding professional responsibility. Ethically, behavior analysts should not deny services solely based on inability to pay, nor should they reduce the quality of services. Considering options like providing some services free, pro bono, or adjusting the fee based on income, sliding scale, are ethical ways to potentially help, but these arrangements must be clear and agreed upon. Crucially, the quality of the service delivered must never be compromised due to financial arrangements. Your ethical duty is to provide competent services regardless of the fee structure. Question 6. Before starting services, a behavior analyst provides a family with a document outlining the scope of services, responsibilities of all parties, fees, and confidentiality limits. What is this document called? A. A behavior intervention plan. B. An assessment report. C. An informed consent form/service agreement. D. A release of information. Answer. C. An informed consent form/service agreement. This question is about the essential documentation required before beginning professional services. The description mentions key elements like scope of services, responsibilities, fees, and confidentiality limits. This precisely describes the purpose and content of an informed consent form or service agreement. It's the formal contract and disclosure process where the client, or guardian, agrees to receive services after understanding what they involve, their rights, costs, and how their information will be handled. A behavior plan is about the intervention itself, an assessment report summarizes findings, and a release of information allows sharing data after services start. Informed consent is the foundational agreement. Question 7. A behavior analyst is supervising a student. The student is struggling to implement a complex procedure correctly. Ethically, what is the supervisor's responsibility? A. Have the student stop implementing that procedure until they are licensed. B. Allow the student to continue practicing, as experience is the best teacher. C. Provide additional training, guidance, and direct observation to ensure competence. D. Assign the student simpler tasks only. Answer C. Provide additional training, guidance, and direct observation to ensure competence. This question focuses on the ethical responsibilities of a supervisor. When a supervisee is struggling, the supervisor cannot simply abandon them, let them practice incorrectly, potentially harming the client, or restrict them only to easy tasks. The supervisor's ethical duty is to ensure the supervisee becomes competent. This involves providing the necessary support, which includes more training, clearer instructions, and observing them directly to give feedback and correct errors in real time. This ensures both the student's learning and the client's safety and receiving quality services. Good supervision is hands-on and aims to build skills. Question 8. A behavior analyst is presenting data about a client's progress at a professional conference. What ethical obligation must they fulfill regarding the client's identity? A. Use the client's full name and identifying details to make the case clear. B. Obtain explicit written consent from the client/guardian to use their identifying information. C. Present the data anonymously, removing all personally identifiable information. D. Mention the client's first name only, but change other details. Answer C. Present the data anonymously, removing all personally identifiable information. This question is about protecting client confidentiality when sharing information publicly, such as at a conference. The ethical code requires behavior analysts to protect client privacy. While you can discuss general cases or present data, you must remove anything that could identify the specific individual. This includes names, unique characteristics, locations, or any combination of details that could potentially link the data back to the client, unless you have obtained explicit written consent specifically for that purpose. Presenting data anonymously by removing identifying details is the standard and safest ethical practice when sharing case information in public forums like conferences. Question 9. A behavior analyst is developing a new behavior intervention plan for a child. When should the behavior analyst review and update the plan? A. Only if the child's behavior gets worse. B. Every 6 months, regardless of progress. C. Regularly, based on ongoing data collection and a client's progress. D. Only when the funding source requires a review. Answer C. Regularly, based on ongoing data collection and the client's progress. This question tests your understanding of the dynamic nature of behavior intervention and the need for ongoing evaluation. Behavior analysis is an empirical science, meaning decisions are based on data. A behavior plan isn't a static document. It's a living guide that must be adjusted as needed. You must collect data regularly to see if the plan is working. If the data show progress, you might adjust goals. If there's no progress or the behavior changes, you must modify the plan. Waiting for behavior to worsen or relying only on arbitrary timeframes or funder requirements isn't sufficient. Ethical practice demands continuous monitoring and updating based on the client's individual needs and response to treatment, guided by the data. Question 10. A behavior analyst is working in a setting with other professionals who use different intervention approaches. Ethically, how should the behavior analyst interact with these colleagues? A. Criticize their approaches as not being evidence-based. B. Only collaborate with those who use ABA methods. C. Respectfully collaborate, sharing relevant information and coordinating care when appropriate. D. Ignore their interventions and focus only on their own plan. Answer C. Respectfully collaborate, sharing relevant information and coordinating care when appropriate. This question addresses the ethical responsibility of collaboration with other professionals. Clients often receive services from multiple providers, example, speech therapists, occupational therapists, teachers. Ethically, behavior analysts should work respectfully with others involved in the client's care. This means communicating relevant information, coordinating goals and strategies to ensure consistency and avoid conflicts, and respecting their professional opinions, even if their methods differ, as long as they are within their scope and beneficial to the client. Criticizing others, isolating yourself, or ignoring other services is detrimental to the client's overall well-being and progress. Collaboration is key to providing holistic care. Question 11. A behavior analyst discovers that a colleague is practicing outside their area of competence. What is the ethical responsibility of the discovering behavior analyst? A. Ignore it, as it is not their responsibility. B. Report the colleague to the Behavior Analytics Certification Board immediately. C. Address the issue directly with the colleague first, if possible, or report if necessary. D. Discuss the colleague's incompetence with other colleagues. Answer: C. Address the issue directly with the colleague first, if possible, or report if necessary. This question is about the ethical obligation to address potential ethical violations or incompetent practice by colleagues. The ethical code requires behavior analysts to uphold professional standards. While reporting to the board is an option, the first step, if feasible and not harmful, is often to try and resolve the issue directly with the colleague. They might be unaware they are practicing outside their scope or be amenable to guidance. If addressing it directly is not possible, doesn't resolve the issue, or the behavior is harmful or illegal, then reporting to the relevant authority, like the certification board or licensing board, becomes necessary. Discussing it with other colleagues without action is not sufficient or appropriate. Question 12. When should a behavior analyst obtain informed consent? A. Only when using restrictive procedures. B. Before implementing any assessment or intervention procedure. C. When the client or guardian asks for it. D. After services have been provided for a few weeks. Answer: B. Before implementing any assessment or intervention procedure. This question is about the timing of informed consent, a foundational ethical requirement. Informed consent is not something you get only for certain procedures or upon request, nor is it obtained after services have started. It is a process that must occur before you begin working with a client in any significant way, including conducting initial assessments or starting intervention. The client/guardian must understand what you plan to do, the potential benefits and risks, and agree to proceed before you start. It's the cornerstone of respecting autonomy and ensuring the client/guardian is fully aware of the proposed services. Question 13. A behavior analyst wants to use a new experimental intervention technique. Ethically, what is required before using this technique with a client? A. Ensure it has been published in a peer-reviewed journal. B. Discuss it with a colleague who has used it before. C. Obtain explicit informed consent from the client/guardian, explaining it is experimental, and have a plan for monitoring effectiveness. D. Use it with several clients to see if it works before getting consent. Answer: C. Obtain explicit informed consent from the client/guardian, explaining it is experimental, and have a plan for monitoring effectiveness. This question deals with the ethical use of novel or experimental procedures. The keyword experimental is crucial. Using procedures that are not yet widely established requires extra ethical precautions. You cannot simply use it because it's published or a colleague mentioned it. You absolutely must inform the client or guardian that the procedure is experimental, clearly explain what is known and unknown about its effectiveness and potential risks, and obtain their explicit consent after this full disclosure. You also need a rigorous plan to collect data and monitor its effects to ensure it's not harmful and is potentially beneficial, adjusting or discontinuing if necessary. You cannot experiment on clients without their informed agreement. Question 14. A behavior analyst is asked to provide services to a client in a remote area where there are no other behavior analysts. The behavior analyst has experience with similar clients, but is not an expert in this specific population's unique needs. What ethical consideration is most important? A. Decline services due to lack of expertise in the specific population. B. Provide services based on their general experience. C. Provide services only after obtaining training and supervision in the specific population's needs. D. Inform the client they are not an expert but provide services anyway. Answer C. Provide services only after obtaining training and supervision in the specific population's needs. This question addresses providing services when there are no other local providers, which can sometimes lead to requests outside one's core expertise. While you shouldn't practice entirely outside your scope, if there's a desperate need and you have some related experience, the ethical path isn't always to decline immediately. It's to ensure you become competent to serve that population. This means seeking additional training, education, or supervision from someone who is an expert in that specific area before or while providing services. Simply providing services based on general experience or informing the client you're not an expert without getting the necessary training is not sufficient to ensure competent practice. Question 15. A behavior analyst is designing a token economy system. Ethically, what should tokens be exchangeable for? A. Only primary reinforcers like food. B. Whatever is easiest to provide. C. A variety of backup reinforcers that are truly reinforcing for the client. D. Nothing. The tokens themselves should be the reinforcer. Answer C. A variety of backup reinforcers that are truly reinforcing for the client. This question is about the ethical design of reinforcement systems, specifically token economies. Tokens themselves don't inherently reinforce behavior. They gain value because they can be traded for other things that are reinforcing, backup reinforcers. Ethically and effectively, these backup reinforcers must be chosen based on what is actually motivating and preferred by the individual client, not just what's easy or primary, like food, which isn't always appropriate or ethical as the sole reinforcer. Offering a variety of preferred items or activities ensures the system is effective and respects the client's preferences. Tokens should be exchanged for things the client genuinely wants to earn. Question 16. A behavior analyst uses punishment procedures in a behavior intervention plan. According to ethical guidelines, when should punishment be considered? A. As the first intervention strategy to quickly stop challenging behavior. B. Only after less restrictive procedures have been attempted and proven ineffective. C. If the challenging behavior is dangerous, regardless of prior attempts. D. If the funding source approves its use. Answer B. Only after less restrictive procedures have been attempted and proven ineffective. This question focuses on the ethical considerations surrounding the use of punishment, which is a more restrictive and potentially harmful intervention. The ethical code emphasizes the principle of the least restrictive alternative. Punishment should not be the first choice. It should only be considered and potentially used when less intrusive methods, such as positive reinforcement strategies for teaching replacement behaviors, have been tried systematically and data show they are not sufficient to address the challenging behavior. Even if the behavior is dangerous, you still prioritize less restrictive, function-based interventions first, escalating to punishment only when necessary and justified by data, and always with strict safeguards and monitoring. Question 17. A behavior analyst working for an agency is asked by their supervisor to implement a treatment plan that the behavior analyst believes is unethical and potentially harmful to the client. What is the behavior analyst's ethical obligation? A. Implement the plan as directed by the supervisor. B. Refuse to implement the plan and immediately resign. C. Discuss concerns with the supervisor and attempt to resolve the conflict ethically. D. Report the supervisor to the certification board immediately. Answer C. Discuss concerns with the supervisor and attempt to resolve the conflict ethically. This question addresses navigating ethical conflicts, particularly when directed by a supervisor to do something you believe is wrong. Your ethical duty is not to blindly follow orders that violate the code. However, the first step isn't usually immediate resignation or reporting. The ethical code typically requires you to try and resolve the issue through communication. You should clearly articulate your concerns to the supervisor, explaining why you believe the plan is unethical based on the code and data. You should attempt to reach an ethical resolution. If this discussion doesn't resolve the conflict, then further steps, which might include seeking guidance from others or reporting, would be considered. Question 18. A behavior analyst receives a gift from a client's family. The gift is a small, inexpensive item, clearly intended as a token of appreciation. Ethically, how should the behavior analyst respond? A. Graciously accept the gift as a sign of appreciation. B. Refuse the gift firmly to maintain professional boundaries. C. Accept the gift but donate it to charity. D. Evaluate the gift based on its value and potential impact on the professional relationship. Answer D. Evaluate the gift based on its value and potential impact on the professional relationship. This question is about accepting gifts from clients, which can blur professional boundaries and create conflicts of interest. The ethical code doesn't have a strict rule prohibiting all gifts, but it requires careful consideration. Accepting large or expensive gifts is generally unethical, as it could create a sense of obligation or influence clinical judgment. Small, inexpensive tokens of appreciation are less likely to pose an ethical issue, but you still need to consider the intent, the value, the frequency, and how it might be perceived or impact the professional relationship. It's not about the gift itself, but the potential influence and boundary implications. If it's a small, one-time token, it might be acceptable, but a pattern of gifts or expensive items would not be. Always consider the potential impact on your objectivity and the relationship. Question 19. A behavior analyst is asked to provide services for a client, but they realize they do not have the necessary training or experience with the client's specific diagnosis and challenging behaviors. What is the most ethical course of action? A. Accept the case and learn on the job. B. Decline the case because it is outside their scope of competence. C. Accept the case but limit the services provided. D. Accept the case and seek supervision from an expert in that area. Answer D. Accept the case and seek supervision from an expert in that area. This question again touches on the ethical obligation to practice within one's scope of competence. If you realize you lack specific expertise, accepting the case and just figuring it out, A, or limiting services without proper competence, C, are unethical. While declining might sometimes be necessary, B, if there are no other providers and you have a related background, the most ethical path is often to accept the case, but immediately seek out and work under the supervision of someone who is competent in that specific area. This allows the client to receive needed services while ensuring you gain the necessary skills under guidance. It's about expanding your competence responsibly. Question 20. Before implementing any behavior change program, a behavior analyst must conduct a functional assessment. What is the primary ethical reason for conducting a functional assessment? A. To identify the topography of the behavior. B. To understand the purpose or function the behavior serves for the individual. C. To determine the frequency of the behavior. D. To satisfy insurance requirements. Answer B. To understand the purpose or function the behavior serves for the individual. This question highlights the ethical necessity of conducting a functional assessment, FA. While identifying what the behavior looks like, topography, or how often it happens, frequency, are parts of an assessment, the primary purpose of an FA is to figure out why the behavior is happening, what function or purpose it serves for the person, example, getting attention, escaping a demand, accessing an item, sensory input. Ethically, interventions should be based on the function of the behavior, not just its form. Interventions based on function are more likely to be effective and respectful because they address the underlying reason the person is engaging in the behavior. Implementing interventions without understanding the function is like treating a symptom without knowing the cause, ineffective and potentially harmful. Question 21. A behavior analyst is working with a client who is a minor, who typically holds the right to grant informed consent for services. A. The minor client themselves. B. The the funding source. C. The client's parent or legal guardian. D. The school administrator. Answer: C. The client's parent or legal guardian. This question is about who provides consent for services when the client is a child, a minor. Minors are not legally able to give informed consent for most significant decisions, including healthcare and behavioral services. This authority rests with their parent, or legally appointed guardian. The funder determines payment, and school administrators don't hold consent authority for healthcare. While you might explain things to the child in an age-appropriate way, the legal and ethical consent must come from the responsible adult. Question 22. A behavior analyst is writing a report about a client. What type of language should they use in the report? A. Technical ABA jargon to demonstrate expertise. B. Emotional or subjective language to convey the client's struggles. C. Clear, objective, and data-based language. D. Language that guarantees positive outcomes. Answer: C. Clear, objective, and data-based language. This question focuses on the ethical and professional standard for documentation. Reports should be factual, unbiased, and based on observable data. Using overly technical jargon without explanation can make the report inaccessible to others. Emotional or subjective language is unprofessional and lacks the objectivity required in a scientific discipline. Guaranteeing outcomes is unethical and impossible in practice. Therefore, reports must use clear language that accurately describes behaviors, interventions, and data without personal bias or unsubstantiated claims. Question 23. What is the ethical requirement regarding client records retention? A. Records can be disposed of once services end. B. Records must be kept indefinitely. C. Records must be retained for a minimum period, as specified by laws, regulations, and professional standards. D. Records only need to be kept until the bill is paid. Answer: C. Records must be retained for a minimum period, as specified by laws, regulations, and professional standards. This question is about the ethical and legal requirements for keeping client records. You cannot just throw away records when services stop or the bill is paid. There are specific rules about how long you must keep client documentation to ensure continuity of care, meet legal obligations, and protect yourself in case of legal issues. These rules vary by location, state/country, and professional standards, like the BACB. You need to know the requirements for your specific practice location, but it's always for a minimum period, not indefinitely or until payment. Question 24. A behavior analyst is asked to provide a testimonial for a product or service related to behavior analysis. Ethically, what must be true about this testimonial? A. It must be based on personal belief, not necessarily data. B. It must be paid for by the company providing the product/service. C. It must be an unsolicited, objective, and verifiable statement based on their expertise. D. It must guarantee positive results for anyone using the product/service. Answer: C. It must be an unsolicited, objective, and verifiable statement based on their expertise. This question deals with ethical guidelines for endorsements and testimonials. Behavior analysts should not give testimonials that are solicited, especially if paid, or that make false or exaggerated claims. Any testimonial should be a genuine reflection of the behavior analyst's professional opinion, based on data or expertise, and be verifiable. They absolutely cannot guarantee specific results for others. This protects the public from misleading endorsements. Question 25. A behavior analyst is supervising a student and discovers the student has engaged in a serious ethical violation. What is the supervisor's primary ethical obligation? A. Terminate supervision immediately. B. Provide the student with further ethics training. C. Report the violation to the appropriate authority, example BACB, if required by the ethical code or law. D. Keep the violation confidential within the supervisory relationship. Answer: C. Report the violation to the appropriate authority, example, BACB, if required by the ethical code or law. This question is about a supervisor's responsibility when a supervisee commits a serious ethical violation. While providing further training might be part of the response, and terminating supervision is possible, the primary ethical duty shifts when the violation is serious. The supervisor has an obligation to protect the public and the integrity of the profession. If the violation meets the criteria for mandatory reporting as defined by the ethical code or relevant laws/regulations, the supervisor must report it to the appropriate authority, like the BACB. Keeping a serious violation confidential is unethical. Question 26. When developing a behavior intervention plan, the behavior analyst should involve the client or their guardian in the process. What ethical principle does this align with? A. Beneficence, doing good. B. Non-maleficence, avoiding harm. C. Autonomy, respecting the right to choose. D. Fidelity, being truthful. Answer: C. Autonomy, respecting the right to choose. This question connects the action of involving clients/guardians in planning to an ethical principle. While the plan aims to do good, beneficence, and avoid harm, non-maleficence, actively involving the person receiving services or their decision-maker. In the development process is a direct application of respecting their autonomy, their right to make informed decisions about their own lives and treatment. It ensures the plan aligns with their values, preferences, and goals as much as possible. Fidelity is about trustworthiness and truthfulness. Question 27. A behavior analyst provides consultation services remotely via telehealth. What ethical consideration is particularly important in this context? A. Ensuring the client has the necessary technology for the sessions. B. Maintaining confidentiality and security of electronic communications and data. C. Adjusting fees for remote services. D. Avoiding direct observation of behavior. Answer: B. Maintaining confidentiality and security of electronic communications and data. This question focuses on ethics in the context of telehealth. While technical access and fees are practical considerations, the ethical aspect highlighted here is paramount in electronic communication. Transmitting information electronically adds layers of risk regarding privacy breaches and data security. Behavior analysts must use secure platforms, protect electronic records, and ensure that the remote environment for both the analyst and the client is private during sessions. Confidentiality remains a top priority, and using technology requires specific measures to protect it. Question 28. A behavior analyst is developing a professional relationship with a client. Which of the following is not considered an ethical multiple relationship by the ethical code? A. Being the client's behavior analyst and their therapist for unrelated mental health issues. B. Being the client's behavior analyst and their direct family member. C. Being the client's behavior analyst and the supervisor for their job placement program. D. Being the client's behavior analyst and receiving payment for services. Answer: D. Being the client's behavior analyst and receiving payment for services. This question asks which scenario is not an ethical multiple relationship. A multiple relationship occurs when a behavior analyst has both a professional role with a person, client, supervisee, etc., and another role, personal, financial, other professional. Options A, B, and C describe situations where the behavior analyst has a professional role, analyst or supervisor, and another distinct role, therapist, family member, job supervisor, with the same individual, which constitutes a multiple relationship that needs careful management or avoidance. Receiving payment for services, D, is the standard, expected part of a professional relationship and is not considered a multiple relationship. Question 29. When advertising professional services, a behavior analyst must ensure their advertisement is A. Guaranteed to attract many clients. B. Based on testimonials from past clients. C. Truthful and not misleading. D. Focused on comparing their services favorably to competitors. Answer: C. Truthful and not misleading. This question is about ethical advertising. Advertisements for professional services must be accurate and avoid making false claims or implying results that cannot be guaranteed. They should not mislead the public about the nature of the services, qualifications, or outcomes. While testimonials might sometimes be used ethically under strict conditions, as discussed in a previous question, they are not a requirement, nor should ads guarantee results or focus on negatively comparing competitors. Honesty and accuracy are the key ethical requirements for advertising. Question 30. A behavior analyst is considering terminating services for a client due to lack of progress despite implementing the plan with fidelity. What ethical step is required before terminating? A. Simply inform the family that services are ending. B. Discuss the lack of progress with the family and attempt to make necessary adjustments or offer referrals. C. Continue services indefinitely, hoping for progress. D. Terminate services immediately to avoid further billing. Answer: B. Discuss the lack of progress with the family and attempt to make necessary adjustments or offer referrals. This question is about the ethical process of terminating services. You cannot just stop providing services abruptly, even if there's no progress. Ethically, you must attempt to resolve the issue first. This involves communicating with the client/guardian about the lack of progress based on the data, discussing potential reasons, exploring alternative strategies or modifications to the plan, and if necessary, offering to help them find other providers who might be a better fit or have different expertise. Referral. Termination should be a planned process, not an abrupt cutoff, ensuring the client isn't left without support. Question 31. When making public statements, such as on social media or in interviews, behavior analysts must: A. Share personal opinions freely. B. Only discuss general topics, never specific clients. C. Ensure statements are consistent with the ethical code and do not make unsubstantiated claims. D. Promote their own services primarily. Answer: C. Ensure statements are consistent with the ethical code and do not make unsubstantiated claims. This question addresses the ethical responsibilities of behavior analysts when making public statements. As professionals, their public communication reflects on the field. They must be careful not to violate confidentiality, so no discussing specific clients, make false or exaggerated claims about services or the field, or make statements that are contrary to the ethical code. While general topics are fine, the core ethical requirement is accuracy, honesty, and adherence to professional standards in all public communication. Sharing personal opinions unrelated to the profession is generally permissible, but professional public statements must be ethical. Question 32. A behavior analyst is working on a research study. What is the most important ethical consideration when involving human participants in research? A. Paying participants for their time. B. Obtaining informed consent from participants or their guardians. C. Ensuring the study yields statistically significant results. D. Publishing the results quickly. Answer: B. Obtaining informed consent from participants or their guardians. This question focuses on the primary ethical consideration in research involving people. While research ethics are complex, the absolute cornerstone is informed consent. Potential participants must be fully informed about the purpose of the research, procedures, potential risks and benefits, confidentiality measures, and their right to withdraw at any time without penalty. They must understand this information and voluntarily agree to participate before the research begins. This respects their autonomy and protects them from being used in research without their knowledge and agreement. Question 33. A behavior analyst is creating materials for a workshop for parents. When using examples ethically, the behavior analyst must: A. Use real-life examples with the client's name, if permission is granted. B. Use hypothetical or disguised examples that do not identify any specific client. C. Only use examples from published research studies. D. Avoid using any examples involving children. Answer: B. Use hypothetical or disguised examples that do not identify any specific client. This question is about maintaining confidentiality when using examples for training or presentation purposes. Even if a client or guardian grants permission, using identifying information can still compromise privacy, and it's generally unnecessary. The ethical standard is to use examples that are either completely hypothetical or so significantly disguised that they cannot be linked back to any specific individual client. This protects confidentiality while still allowing the behavior analyst to illustrate concepts effectively. Question 34. A behavior analyst holds the BCBA certification. What does this certification ethically require regarding ongoing learning? A. The behavior analyst is not required to learn new information once certified. B. The behavior analyst must only attend workshops provided by the BACB. C. The behavior analyst must engage in ongoing professional development to maintain competence. D. The behavior analyst should only read research relevant to their current clients. Answer: C. The behavior analyst must engage in ongoing professional development to maintain competence. This question is about the ethical obligation of competence and continuing education. Holding a certification like the BCBA is not the end of learning. The field of behavior analysis is constantly evolving with new research and best practices. Ethical behavior analysts have a responsibility to stay current in their knowledge and skills. This requires engaging in ongoing professional development, such as attending workshops, reading research, and seeking supervision or consultation when needed. This is essential to provide effective and up-to-date services. Question 35. A behavior analyst receives confidential information about a client from a third-party, example, a teacher, who is not involved in the client's ABA services. What should the behavior analyst do with this information ethically? A. Use the information freely in the client's plan as it might be helpful. B. Ignore the information as it was not received directly from the family. C. Verify the information with the client/guardian if appropriate and ensure its use is within the scope of consent. D. Share the information with the client's other providers immediately. Answer: C. Verify the information with the client/guardian if appropriate and ensure its use is within the scope of consent. This question addresses handling unsolicited confidential information from a third party. While the information might be relevant, receiving it from someone not authorized to share it raises confidentiality issues. Ethically, you cannot just integrate it into your work without the client's/guardian's knowledge and consent regarding who you can receive information from and how that information can be used. You should clarify with the third party how they obtained the information and inform the client/guardian about receiving it. You should then determine, with the client's consent, if and how this information can be used within the boundaries of your professional relationship and service agreement. Question 36. A behavior analyst is working with a client with complex medical needs. Ethically, what is the behavior analyst's role regarding these medical needs? A. Provide medical advice related to the client's behavior. B. Incorporate the client's medical needs and information into the behavior plan with consent and collaborate with medical professionals. C. Ignore the medical needs and focus only on observable behavior. D. Suggest alternative medical treatments to the family. Answer: B. Incorporate the client's medical needs and information into the behavior plan with consent and collaborate with medical professionals. This question is about the ethical requirement to consider the client's overall well-being, which includes medical factors. Behavior is complex and can be influenced by medical conditions, medication side effects, or pain. Ethically, behavior analysts must be aware of relevant medical information, with consent, and consider how it impacts behavior. They should collaborate with medical professionals, share relevant behavioral data, and ensure the behavior plan is consistent with medical recommendations. They must not provide medical advice or suggest treatments outside their scope. Ignoring medical needs is also unethical, as it can lead to ineffective or harmful interventions. Question 37. Before providing services, a behavior analyst discusses the potential risks and benefits of the proposed intervention with the client/guardian. Which ethical principle does this directly support? A. Justice. B. Autonomy. C. Competence. D. Integrity. Answer B. Autonomy. This question connects discussing risks and benefits to an ethical principle. Providing information about potential risks and benefits is a core component of the informed consent process. This process is fundamentally about ensuring the client/guardian has the necessary information to make a voluntary, informed decision about whether or not to receive services or specific interventions. This directly upholds their autonomy, their right to self-determination, and to control what happens to them. Justice is about fairness, competence is about skill, and integrity is about honesty and trustworthiness. Question 38. A behavior analyst is asked to use a specific intervention technique requested by a parent, but the technique is not supported by scientific evidence and is potentially harmful. Ethically, the behavior analyst must A. Agree to use the technique to satisfy the parent. B. Implement the technique but collect data to show it doesn't work. C. Decline to use the technique and explain to the parent why it is not evidence-based or ethical. D. Suggest a modified version of the technique. Answer C. Decline to use the technique and explain to the parent why it is not evidence-based or ethical. This question is about the ethical obligation to use evidence-based practices and protect clients from harm. Behavior analysts must rely on scientifically supported methods. If a requested technique lacks evidence or is potentially harmful, you cannot ethically implement it, even if the parent requests it. You must explain your concerns to the parent, educate them about evidence-based alternatives, and decline to use the unsupported or harmful method. Your primary ethical responsibility is to the client's well-being and using effective, safe practices. Question 39. A behavior analyst discovers that a colleague is experiencing burnout and making errors that could impact client care. What is an ethical step the behavior analyst could take? A. Cover for the colleague and correct their errors without telling anyone. B. Advise the colleague to take a vacation. C. Encourage the colleague to seek support, example, consultation, supervision, personal counseling, and offer assistance if appropriate and within boundaries. D. Report the colleague's errors anonymously. Answer C. Encourage the colleague to seek support, example, consultation, supervision, personal counseling, and offer assistance if appropriate and within boundaries. This question is about addressing concerns regarding a colleague's professional impairment, such as burnout, which can affect their competence. While serious ethical violations might require reporting, noticing a colleague struggling with stress or burnout warrants a supportive approach first. If the situation allows, ethically, you should encourage them to seek the necessary support, professional or personal, to regain their ability to practice competently. Offering support might involve listening or providing resources within professional boundaries, but it's not your role to cover up errors, which is unethical, or just tell them to take time off. Anonymous reporting might be necessary in some cases, but offering support for impairment is often a first step when appropriate. Question 40. When discussing a client with another professional involved in their care, what is the ethical requirement regarding sharing information? A. Share all client information to provide a complete picture. B. Share only information that is relevant to the other professional's role and within the scope of consented information sharing. C. Avoid sharing any information to maintain strict confidentiality. D. Share information only if the other professional is also a behavior analyst. Answer B. Share only information that is relevant to the other professional's role and within the scope of consented information sharing. This question focuses on ethical information sharing with other professionals. While collaboration is important, you cannot share everything about a client just because another professional is involved. You must have obtained consent to share information in the first place, and then you only share the minimum amount of information necessary that is relevant to that specific professional's role in the client's care. This respects the client's privacy while facilitating effective teamwork. You share information based on relevance and consent, not the other professional's discipline. Question 41. A behavior analyst is asked to design a group intervention. Ethically, what must the behavior analyst consider regarding the individual clients in the group? A. All clients in the group must have the exact same goals. B. The intervention must meet the needs of the group as a whole, even if some individuals don't benefit. C. The intervention must be individualized to some extent to meet the unique needs and goals of each client within the group context. D. Individual data collection is not necessary in a group setting. Answer: C. The intervention must be individualized to some extent to meet the unique needs and goals of each client within the group context. This question addresses ethical considerations in group settings. While group interventions can be efficient, behavior analysis is fundamentally about individual behavior change. Even in a group, you must consider the unique goals, needs, and responses of each person. The intervention needs to be adaptable or designed in a way that allows for individual progress and addresses specific behaviors or goals within the group structure. You must still collect data on individual progress to ensure the intervention is effective for each person, not just the group average. Question 42. A behavior analyst is involved in a billing dispute with a client's funding source. Ethically, how should this dispute be handled regarding the client's services? A. Stop services immediately until the dispute is resolved. B. Continue services as usual while attempting to resolve the dispute through professional channels. C. Reduce the intensity of services during the dispute. D. Require the family to pay out of pocket until the dispute is resolved. Answer: B. Continue services as usual while attempting to resolve the dispute through professional channels. This question is about ethical conduct during billing disputes. Financial issues between the provider and the funder should not negatively impact the client's access to medically necessary or agreed-upon services. Unless the service agreement explicitly states otherwise, or the dispute directly prevents the provision of services, example, denied authorization makes continued service illegal. You should continue providing services while working to resolve the billing issue with the funder. Abruptly stopping or reducing services punishes the client for a financial dispute they are often not responsible for resolving. Question 43. When creating behavior goals for a client, ethically, these goals should be: A. Solely determined by the behavior analyst. B. Determined by the funding source based on approved hours. C. Developed collaboratively with the client/guardian and based on assessment data and their priorities. D. Focused only on decreasing challenging behaviors. Answer: C. Developed collaboratively with the client/guardian and based on assessment data and their priorities. This question focuses on the ethical process of goal setting in behavior analysis. Goals should not be unilaterally decided by the behavior analyst or dictated solely by funding. Ethical practice requires goals to be based on objective assessment data, understanding the client's current skills and challenges, and developed in partnership with the client or their guardian. Their priorities, values, and desired outcomes must be central to the goal-setting process. Goals should also focus on building skills and functional behaviors, not just reducing challenging ones. Question 44. A behavior analyst is conducting a risk-benefit analysis for a proposed intervention. What is the ethical purpose of this analysis? A. To justify the most expensive intervention. B. To determine if the potential benefits to the client outweigh the potential risks of the intervention. C. To predict the exact outcome of the intervention. D. To satisfy administrative requirements. Answer: B. To determine if the potential benefits to the client outweigh the potential risks of the intervention. This question is about the ethical requirement to conduct a risk-benefit analysis before implementing interventions, especially those that might be restrictive or involve potential risks. The core ethical purpose is to weigh the potential positive effects, benefits like skill acquisition or behavior reduction, against the potential negative effects, risks like side effects, discomfort, or loss of autonomy. You should only proceed with an intervention if, based on the best available information and professional judgment, the likely benefits to the client are greater than the likely risks. It's a critical step in applying the principle of non-maleficence, avoiding harm. Question 45. A behavior analyst uses positive reinforcement as a primary intervention strategy. What ethical principle does the emphasis on positive reinforcement align with? A. Using the most restrictive alternative. B. Focusing on punishment first. C. Emphasizing the least restrictive and most humane procedures. D. Maximizing billable hours. Answer. C. Emphasizing the least restrictive and most humane procedures. This question links the common practice of using positive reinforcement to an ethical principle. Positive reinforcement is a fundamental principle of behavior and is generally considered a less intrusive and more humane approach compared to punishment. It focuses on building desired behaviors by adding something pleasant. Ethically, behavior analysts are encouraged to use positive, constructive methods first before considering more restrictive or aversive procedures. This aligns with the principle of seeking the least restrictive alternative that is likely to be effective. Question 46. A behavior analyst is considering accepting a client whose needs are significantly outside their experience. Which ethical guidelines should heavily influence their decision? A. The need to help as many people as possible. B. The ability to bill for many hours. C. The responsibility to practice within their boundaries of competence. D. The opportunity to learn a new skill. Answer. C. The responsibility to practice within their boundaries of competence. This question is similar to previous ones, but emphasizes the decision before accepting the client. When faced with a potential client whose needs are beyond your current skill set or experience, the primary ethical consideration is your competence. You have an ethical obligation to practice only within the areas where you are qualified. While helping people is the overall goal, helping outside your competence can potentially cause harm. The opportunity to learn is not an ethical justification for accepting a case you are not prepared for without proper supervision or training. Question 47. What is the ethical purpose of ongoing supervision for behavior analysts, especially those pursuing certification or new to practice? A. To ensure billable hours are maximized. B. To provide administrative oversight. C. To ensure the behavior analyst practices competently and ethically. D. To assign cases to the supervisee. Answer. C. To ensure the behavior analyst practices competently and ethically. This question focuses on the ethical rationale for supervision. Supervision is a cornerstone of ethical practice in behavior analysis, especially for those learning or refining their skills. The main goal is not administrative control or task assignment, but to guide the supervisee, evaluate their performance, provide feedback, and ensure they are providing services effectively, competently, and in line with the ethical code. It's a safeguard for client well-being and professional development. Question 48. A behavior analyst maintains client records securely to prevent unauthorized access. Which ethical principle is this primarily addressing? A. Beneficence. B. Integrity. C. Confidentiality. D. Responsibility. Answer. C. Confidentiality. This question connects securing client records to an ethical principle. The act of protecting records from unauthorized access is directly related to the ethical duty of maintaining confidentiality. You are entrusted with sensitive personal information, and you must take reasonable steps to ensure that only authorized individuals have access to it. Beneficence is doing good, integrity is honesty, and responsibility is overall accountability. While all might play a role, securing records is the direct application of confidentiality. Question 49. A behavior analyst is working with a client who is also receiving services from another ABA agency. Ethically, what should the behavior analyst do? A. Refuse to provide services since the client is already receiving ABA. B. Coordinate with the other agency if consent is obtained from the client/guardian. C. Tell the client/guardian to choose only one agency. D. Assume the other agency is not providing quality services. Answer B. Coordinate with the other agency if consent is obtained from the client/guardian. This question deals with coordinating care when a client receives services from multiple providers, including other ABA providers. It is not unethical for a client to receive services from multiple sources, though funding might be a barrier. If they are, and you have the client's/guardian's explicit consent, you should ethically coordinate care with the other provider. This involves communicating about goals, strategies, and progress to ensure consistency, avoid conflicting interventions, and maximize the client's benefit. Assuming poor quality or demanding they choose is unprofessional and unethical. Question 50. A behavior analyst is asked to advocate for a client's access to needed services. When advocating, the behavior analyst should A. Make exaggerated claims about the potential outcomes of ABA. B. Only advocate if they are paid extra for it. C. Advocate based on the client's needs and the principles of behavior analysis, using accurate information. D. Advocate by criticizing other service providers. Answer C. Advocate based on the client's needs and the principles of behavior analysis, using accurate information. This question is about the ethical role of advocacy. Behavior analysts have an ethical responsibility to advocate for their clients' best interests and access to effective services. When advocating, it must be done professionally and ethically. This means basing your advocacy on the client's demonstrated needs, the principles of evidence-based practice, obey, and using truthful and accurate information. You should not exaggerate claims, require extra payment specifically for advocacy. It's part of ethical practice, or engage in unprofessional criticism of others. Question 51. What is the ethical concept that requires behavior analysts to design interventions that are effective and based on scientific evidence? A. Autonomy. B. Social validity. C. Empiricism. D. Integrity. Answer C. Empiricism. This question asks for the concept that grounds interventions in data and science. Empiricism is a core dimension of ABA, meaning that decisions and interventions are based on objective, observable data and scientific evidence. Ethically, behavior analysts must use methods that have been shown through research to be effective. This isn't just a scientific principle, it's an ethical one because using ineffective or unsupported methods wastes resources, delays progress, and can potentially harm the client. Social validity relates to the goals and procedures being acceptable and important to the client/society. Autonomy is about choice, and integrity is about honesty. Question 52. A behavior analyst receives a request for client records from an insurance company. What is the ethical requirement before releasing these records? A. Get verbal permission from the client/guardian. B. Obtain a signed release of information form from the client/guardian. C. Send the records immediately, as insurance companies have a right to them. D. Redact all information except for billing codes. Answer B. Obtain a signed release of information form from the client/guardian. This question is about the ethical, and often legal, requirement for releasing confidential client information to third parties, like insurance companies. You cannot just share records because they request them. You must have a signed release of information form from the client or their legal guardian, specifically authorizing you to share information with that specific entity, the insurance company. This form details what information can be shared and for what purpose. Verbal permission is generally not sufficient for releasing confidential records. Question 53. A behavior analyst is terminating services with a client. What is the primary ethical consideration during this transition? A. Minimizing the number of transition meetings. B. Ensuring the client is not abandoned and has access to continued support if needed. C. Getting the final payment from the funding source. D. Disposing of client records immediately. Answer: B. Ensuring the client is not abandoned and has access to continued support if needed. This question focuses on the ethical responsibilities during the termination process. The most important ethical consideration is non-abandonment. You cannot just stop providing services without ensuring the client's needs are met. This means having a plan for transition, discussing it with the client/guardian, providing referrals if necessary, and ensuring they have support during and after the transition period to avoid any gap in necessary care. Focusing on meetings, payment, or records disposal are secondary to ensuring the client's continued well-being. Question 54. A behavior analyst needs to store client data electronically. Ethically, what is crucial regarding this electronic storage? A. Using the cheapest available storage method. B. Storing data on a personal computer without a password. C. Ensuring data is stored securely with appropriate safeguards against unauthorized access and breaches. D. Storing data in a way that allows for easy sharing with anyone. Answer: C. Ensuring data is stored securely with appropriate safeguards against unauthorized access and breaches. This question addresses the ethical and often HIPAA/HITCA requirements for storing electronic client data. Confidentiality and security are paramount. You must use secure methods, such as encrypted databases or password-protected systems that comply with privacy regulations. Storing sensitive data on unsecured personal devices or using easily shareable methods is unethical and potentially illegal. The cost or ease of sharing are not ethical justifications for insecure storage. Question 55. A behavior analyst realizes that the intervention plan they designed is not producing the desired results based on the data. Ethically, what must they do? A. Continue implementing the plan with more intensity. B. Blame the lack of progress on the client or family. C. Analyze the data, reevaluate the plan's effectiveness, and make necessary modifications. D. Terminate services immediately. Answer: C. Analyze the data, reevaluate the plan's effectiveness, and make necessary modifications. This question reinforces the empirical and ethical requirement for ongoing evaluation and adaptation. If the data show the plan isn't working, you don't just keep doing the same thing harder, blame others, or give up. You must act as a scientist. Analyze the data carefully, figure out why it's not working. Is it the plan, implementation, external factors? And use that information to modify the plan. This iterative process of assessment, intervention, data collection, and adjustment is fundamental to effective and ethical behavior analysis. Question 56. A behavior analyst is supervising a student who is implementing a reinforcement procedure. The supervisor observes that the student is providing reinforcement inconsistently. Ethically, the supervisor should: A. Tell the student they are doing a bad job. B. Take over implementation themselves. C. Provide specific feedback and additional training to the student on the correct implementation of the procedure. D. Document the inconsistency but do nothing else. Answer: C. Provide specific feedback and additional training to the student on the correct implementation of the procedure. This question is about the supervisor's ethical role in correcting supervisee errors. If a supervisee is implementing a procedure incorrectly, the supervisor's duty is to address it directly and constructively. Simply criticizing, taking over permanently, which doesn't help the student learn, or documenting without action are not appropriate supervisory responses. The ethical responsibility is to provide the necessary guidance, training, and feedback to help the student develop competence and ensure the client receives effective treatment. Question 57. A behavior analyst is planning to use extinction for a challenging behavior. What ethical consideration is particularly important when using extinction? A. Ensuring the behavior will decrease immediately. B. Planning for an extinction burst and ensuring safety. C. Using it without combining it with other procedures. D. Avoiding data collection during extinction. Answer B. Planning for an extinction burst and ensuring safety. This question focuses on ethical considerations specific to extinction, a procedure where reinforcement for a previously reinforced behavior is withheld. A common side effect of extinction is an extinction burst, a temporary increase in the frequency, intensity, or variability of the behavior, potentially including aggression. Ethically, when planning to use extinction, you must anticipate this possible side effect, develop strategies to manage it, and ensure the client's and others' safety during the burst. You also need to pair it with reinforcement for alternative behaviors. Not planning for the burst could put the client or others at risk. Question 58. What is the ethical principle of responsible conduct of behavior analysts? A. Only providing services to clients who are easy to work with. B. Maintaining high standards of professional behavior, integrity, and honesty. C. Prioritizing financial gain over client well-being. D. Avoiding interaction with colleagues from other disciplines. Answer B. Maintaining high standards of professional behavior, integrity, and honesty. This question asks for the definition of a broad ethical principle. Responsible conduct encompasses a wide range of professional duties, including acting with honesty, maintaining integrity, being truthful, avoiding conflicts of interest, and generally behaving in a way that upholds the dignity and reputation of the profession. It's about conducting yourself professionally and ethically in all aspects of your work, not just clinical sessions. Question 59. A behavior analyst is required to report suspected child abuse or neglect. What ethical principle guides this requirement? A. Promoting the profession of behavior analysis. B. Prioritizing client confidentiality above all else. C. Protecting clients and the public from harm. D. Avoiding legal involvement. Answer C. Protecting clients and the public from harm. This question highlights a mandatory reporting obligation. While confidentiality is crucial, there are specific situations where it is overridden by a higher ethical duty. Reporting suspected child abuse or neglect is a legal and ethical requirement based on the principle of protecting vulnerable individuals and the public from harm. Your duty to protect someone from serious harm takes precedence over maintaining confidentiality in such cases. Question 60. When conducting an assessment, a behavior analyst should use methods that are A. Quickest and easiest to administer. B. Based on subjective opinions of caregivers. C. Appropriate for the client's age, setting, and behaviors, and supported by scientific literature. D. Only involve direct observation. Answer C. Appropriate for the client's age, setting, and behaviors, and supported by scientific literature. This question is about ethical and effective assessment practices. Assessments should be comprehensive and use methods, like interviews, checklists, and direct observation, that are chosen because they are suitable for the specific client and situation. The methods should be based on scientific evidence and best practices, not just convenience or subjective information. Relying solely on one method or using inappropriate tools can lead to an inaccurate understanding of the client's behavior. Question 61. A behavior analyst receives payment for a referral to another service provider. Ethically, is this permissible? A. Yes, as long as the client receives good services. B. Yes, if the client agrees to it. C. No. Behavior analysts must not accept payment or gifts for professional referrals. D. Only if the payment is small. Answer C. No. Behavior analysts must not accept payment or gifts for professional referrals. This question is about potential conflicts of interest related to referrals. Accepting payment or anything of value for referring a client to another professional or service creates a conflict of interest. It could be perceived that the referral was made for personal financial gain rather than solely based on the client's best interests and the suitability of the other provider. Ethical guidelines strictly prohibit such arrangements. Question 62. A behavior analyst is developing a professional website. Ethically, what information should they include about their credentials? A. Only the highest credential obtained. B. All credentials, regardless of their relevance to behavior analysis. C. Credentials that are current, relevant to the services offered, and presented accurately. D. Credentials from organizations that paid for advertising on the website. Answer C. Credentials that are current, relevant to the services offered, and presented accurately. This question relates to ethical representation of credentials. When presenting yourself and your qualifications publicly, you must be accurate and truthful. You should list credentials that are relevant to the services you provide and ensure they are current. You should not misrepresent credentials, list irrelevant ones, or include credentials from sources that create a conflict of interest, like paying advertisers. Transparency and accuracy in presenting your qualifications are essential for establishing trust with the public. Question 63. When a behavior analyst terminates services due to a conflict of interest that cannot be resolved, what is still an ethical responsibility? A. Avoid any further contact with the client or family. B. Bill for services even after termination. C. Assist the client in finding alternative services if needed. D. Inform the funding source that the client is difficult. Answer C. Assist the client in finding alternative services if needed. This question builds on the concept of ethical termination, specifically when it's due to a conflict of interest. Even in such circumstances, your ethical duty of non-abandonment remains. While you must terminate the relationship due to the conflict, you still have a responsibility to help the client transition and find other suitable providers. Simply cutting ties without providing resources is unethical and potentially harmful. Question 64. A behavior analyst is asked to provide services that conflict with their personal values. Ethically, what should the behavior analyst do? A. Provide the services anyway, putting personal values aside. B. Explain their personal values to the client and persuade them to change goals. C. Decline to provide services if the conflict cannot be managed without compromising ethical standards or service quality. D. Provide the services but express disapproval to the client. Answer C. Decline to provide services if the conflict cannot be managed without compromising ethical standards or service quality. This question deals with the ethical dilemma of personal values conflicting with professional duties. While professionals must often put personal feelings aside, if a service request fundamentally conflicts with your core ethical or professional standards, or if your personal values would significantly impede your ability to provide objective, high-quality services, you may need to decline the case. However, this should be done professionally, explaining that you are not the best fit for this specific situation and ideally offering referrals, rather than imposing your values on the client or providing substandard care. Question 65. A behavior analyst is designing an intervention for a child who engages in self-injurious behavior. Ethically, what is a crucial consideration? A. Using the most powerful reinforcers available. B. Focusing solely on suppressing the self-injury. C. Conducting a thorough functional assessment to understand the function of the behavior and prioritizing safety measures. D. Implementing aversive procedures immediately due to the danger. Answer C. Conducting a thorough functional assessment to understand the function of the behavior and prioritizing safety measures. This question focuses on intervening with serious challenging behaviors like self-injury. While reducing the behavior is a goal, The ethical approach is grounded in understanding why it occurs. A thorough functional assessment is critical to identifying the function, as interventions based on function are more likely to be effective and less intrusive than those just aimed at stopping the behavior's form. Furthermore, given the danger, ensuring safety measures are in place to protect the client during assessment and intervention is paramount and an immediate ethical priority. Aversive procedures should only be considered as a last resort after less restrictive methods have failed and after rigorous ethical review and safeguards. Question 66. When conducting an initial consultation with a potential client/guardian, what ethical information should be discussed? A guarantee of the outcomes they can expect. B. The behavior analyst's personal life. C. The services offered, fees, confidentiality, and their rights. D. Criticisms of other service providers they have used. Answer. C. The services offered, fees, confidentiality, and their rights. This question is about the ethical content of initial discussions with potential clients, the beginning of the informed consent process. Before any formal agreement or service starts, the behavior analyst must transparently explain what they do, how much it costs, how their information will be protected, and what rights they have as recipients of services. This sets the stage for an ethical relationship based on understanding and consent. Guaranteed outcomes are unethical, personal life is inappropriate, and criticizing others is unprofessional. Question 67. A behavior analyst wants to use client data for research purposes. Ethically, this requires A. De-identifying the data so individual clients cannot be identified and obtaining appropriate ethical review board approval if applicable. B. Getting verbal permission from the client. C. Using the data as long as it doesn't mention the client's name. D. Data from clinical services cannot be used for research. Answer. A. De-identifying the data so individual clients cannot be identified and obtaining appropriate ethical review board approval if applicable. This question addresses using clinical data for research. You cannot use identifiable client data for research without explicit informed consent, specifically for research purposes. However, if the data is completely de-identified, all personal information removed so no one can link it back to the individual, it can often be used for research purposes under ethical review board guidelines, as it no longer compromises individual confidentiality. Simply omitting the name might not be enough to de-identify data. Ethical review boards, like ARBs, ensure research is conducted safely and ethically. Question 68. What is the ethical obligation related to selecting interventions based on the client's cultural background? A. Ignore cultural factors and apply standard ABA procedures. B. Recognize that cultural factors might influence behavior and the acceptability of interventions, and adapt procedures accordingly with client input. C. Assume all clients from a certain culture prefer specific interventions. D. Defer all intervention decisions to the client's family based on their culture. Answer. B. Recognize that cultural factors might influence behavior and the acceptability of interventions, and adapt procedures accordingly with client input. This question is about cultural competence in ethical practice. Behavior occurs within a social and cultural context. Ethically, behavior analysts must be aware that cultural factors can influence the client's behaviors, the family's priorities, and how they perceive and accept certain intervention strategies. You should not ignore culture or make assumptions. Instead, you should respect the client's cultural background. Learn about relevant factors through discussion with the client/guardian, and adapt assessment and intervention methods to be culturally sensitive and acceptable while remaining effective and ethical according to ABA principles. Question 69. A behavior analyst provides pro bono services. What is the ethical requirement regarding the quality of these services? A. Pro bono services can be of lower quality than paid services. B. The quality of pro bono services must be the same high standard as paid services. C. Pro bono services do not require data collection. D. Ethical standards do not apply to pro bono work. Answer B. The quality of pro bono services must be the same high standard as paid services. This question addresses the ethical standards for pro bono work, services provided free of charge. Providing services for free does not waive your ethical obligations or professional standards. Regardless of whether you are paid or not, you have an ethical duty to provide competent services, collect data, adhere to the ethical code, and maintain the same level of quality as you would for any paying client. The client's financial situation does not determine the quality of care they deserve. Question 70. A behavior analyst is asked to provide expert testimony in a legal case related to a former client. Ethically, the behavior analyst must A. Decline to participate to avoid legal involvement. B. Only provide testimony that supports the former client. C. Provide truthful, objective testimony based on their data and expertise, within the boundaries of confidentiality laws and consent. D. Use the opportunity to promote ABA services. Answer C. Provide truthful, objective testimony based on their data and expertise, within the boundaries of confidentiality laws and consent. This question concerns ethical conduct when providing expert testimony about a former client. If legally compelled or properly consented to, you may need to provide testimony. Your ethical duty is to be truthful and objective, presenting information based on your professional knowledge, expertise, and the data you collected. You must stay within your scope of competence and respect confidentiality rules, potentially requiring a release of information or being subject to court orders. You cannot be biased towards the former client or use it as a marketing opportunity. Question 71. What is the ethical requirement regarding maintaining professional boundaries with clients and their families? A. Become friends with clients to build rapport. B. Avoid any interaction outside of scheduled therapy sessions. C. Establish clear professional boundaries and avoid relationships that could impair objectivity or exploit the client. D. Share personal problems with clients to build trust. Answer C. Establish clear professional boundaries and avoid relationships that could impair objectivity or exploit the client. This question is about the ethical importance of professional boundaries. While building rapport is essential, it doesn't mean becoming friends or sharing personal information. Professional boundaries define the limits of the relationship, ensuring it remains focused on the client's therapeutic goals and prevents conflicts of interest, impaired judgment, or exploitation. Avoiding all interaction outside sessions might be overly rigid in some community settings, but the core principle is establishing and maintaining clear, ethical lines in the relationship. Question 72. A behavior analyst is documenting sessions. What is the ethical reason for accurate and timely documentation? A. To make it easy to bill for services. B. To provide a clear, objective record of services for continuity of care, ethical accountability, and potential legal purposes. C. To prove that the client is making rapid progress. D. To satisfy administrative requirements that are not ethically relevant. Answer B. To provide a clear, objective record of services for continuity of care, ethical accountability, and potential legal purposes. This question highlights the ethical importance of good documentation. Accurate and timely session notes, reports, and data are not just administrative tasks. They serve crucial ethical functions, ensuring continuity of care if another provider takes over, providing a record for ethical review if concerns arise, and serving as a legal record of the services provided. Documentation should be objective and reflect what actually happened, not exaggerate progress or simply serve billing purposes. Question 73. When using visual aids or materials developed by another behavior analyst in a presentation, ethically, what must you do? A. Use them freely if they are publicly available online. B. Cite the original source and give credit to the creator. C. Modify them significantly so they appear to be your own. D. Assume they are not copyrighted. Answer: B. Cite the original source and give credit to the creator. This question addresses ethical considerations related to intellectual property and giving credit. Using someone else's work, visual aids, materials, research findings, without acknowledging the original source is plagiarism and is unethical. Even if materials are publicly available, you must still give credit to the creator or source. Modifying someone else's work and presenting it as entirely your own is also unethical. Always cite your sources and respect intellectual property. Question 74. A behavior analyst is supervising multiple students. Ethically, what is required regarding the supervision they provide to each student? A. Provide the same amount of supervision to every student. B. Provide supervision based on the individual student's needs, competence, and the complexity of their cases. C. Supervise all students together in group sessions only. D. Focus supervision only on billable activities. Answer: B. Provide supervision based on the individual student's needs, competence, and the complexity of their cases. This question is about ethical supervision practices when supervising multiple individuals. Supervision should be tailored to the supervisee's specific learning needs and skill level. Some students may require more intensive or frequent supervision than others, especially if they are new, working with complex clients, or struggling with certain skills. Providing a one-size-fits-all approach or only supervising during billable hours may not meet the supervisee's learning needs or ensure client safety. Ethical supervision is individualized and focused on competence development. Question 75. What is the ethical responsibility of a behavior analyst regarding the discontinuation of services when a client reaches their goals? A. Continue services to maintain the behavior change indefinitely. B. Transition the client to a less intensive service or fade services systematically while ensuring maintenance of skills. C. Stop services immediately with no transition. D. Only discontinue services if the funding runs out. Answer: B. Transition the client to a less intensive service or fade services systematically while ensuring maintenance of skills. This question is about the ethical process of concluding services when treatment goals are met. The aim of ABA is to produce lasting, functional change. When a client achieves their goals, the ethical approach is not to stop abruptly, abandonment, or continue services unnecessarily, which is unethical and potentially exploitative. Instead, you should plan for the discontinuation of services, which often involves systematically fading the intensity or frequency of support while ensuring the client's skills are maintained and generalized. This transition should be a planned process to support the client's independence and long-term success.